Health equity is a principle that everyone should have a fair and just opportunity to be as healthy as possible. However, we know that significant disparities persist across various communities influenced by factors such as race, ethnicity, socioeconomic status, gender, and geography. Today, we have gathered experts from diverse backgrounds to explore the current state of health equity, systematic barriers contributing to health disparities, innovative strategies to address these challenges, the role of policy, community engagement, and technology in promoting equitable health outcomes.
For so many people in this country, affording their prescription drugs is really a choice that they're making between putting food on the table, paying for their rent. And we are focused, as you know, on seniors, but I've even heard from multi-generations of just the strain that's been on the family for people to not be able to afford their prescription drugs. Thanks to the Inflation Reduction Act, seniors are now paying no more than $35 a month for each covered insulin.
I think that when it comes to DEI, I fight for diversity, equity, and inclusion in the halls of Congress every day. It's one of my highest priorities. And this particular Congress, especially in the House of Representatives, DEI has been demonized, it has been delegitimized, it has been devalued. And so for me, it is pointing it out, it is confronting it, it is making sure that people know that this is not something that we are going to stand for.
Well, I think initially when it comes to diseases for Black women, it needs to be representation for Black women. When we go into our doctor's offices, nothing looks like us. So we are immediately off-put, and then the language that is presented to us and is not speaking to us either. So there's no community in healthcare for those that are not within a certain socioeconomic level to invite them to support the advancement of our health.
Oftentimes we go into communities and we set up shop. We don't know the history of the community. Right. We're not respecting and honoring the community and the legacy of those who have been in the community.
Yes.
And so that is community-based, is recognizing that and placing people that are within the community in positions of power.
Yeah.
Again, it's like knocking down those systems, those racist systems, patriarchal systems that continue to devalue marginalized communities. It's time to give them the voice, give us, take our rightful place.
We had an excellent panel on health equity, and I know we'll have another excellent conversation on higher education and equity. So without further ado, it is my pleasure to welcome you to our conversation. We are thrilled to see so many stakeholders gathered here today. Today, we will explore the critical challenges and opportunities in creating a more equitable higher education system.
With AI, we're able to move at a little bit more speed of relevance in two ways. One, there are things that the student can do independently, and I've sat through these courses, as I'm sure some of you have as well, and the speed at which the instruction happens does not match each student. We can get between that speed and that student's individualized learning with AI. And if we do that, I believe, and we are starting to do that, the persistence from freshman year to sophomore year, there's very good studies that will tell you that will get considerably better.
STEM is all about answering questions and solving problems. And so what we've done and begin to do really aggressively, you can see, is to lean into faculty and professional development around AI. Bringing in experts to engage with our faculty, get them comfortable with the technology, but really trying to help them see that it's a tool and that they should lean into it and use it to help students learn how to think.
My wish is that if I could write the story, America, foundations, corporations would really put respect on our names. You spouted these statistics about what we've been able to do with little. Imagine what we do if equity found us and allowed us to really be players in the game of AI and beyond.